Hello, how are you, everyone? Welcome again to today's iCON forum, our online webinar, Take Charge of Your Health, Living Well Together with Diabetes. I am Barbara Ho. I am the Chief Nursing Officer of iCON Chinese Division and your host today. Today's topic, the theme, again, has to do with diabetes. And iCON is the office is situated on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. We would also like to acknowledge that you are joining us today from many places, near and far, and acknowledge the traditional owners and caretakers of those lands. iCON is an initiative of the UBC Faculty of Medicine. Let's start with Digital Emergency Medicine Initiative. The main purposes are through organizing health seminars, workshops, and using web technology, we can help multicultural the public to know more about prevention of diseases, and also for those who we can instill knowledge for using digital technology to manage your chronic diseases. We hope that we can give you accurate and reliable information for everyone to share. We hope that not only local public can share with this, we hope that through the webinars, we can also spread the knowledge to far and remote places so that everyone can strive to improve our physical health.
Have you ever wanted help managing your health or your family's health? Like getting your lab results faster or finding more information about an illness or medication? Or perhaps you wanted to start exercising but weren't sure where to begin or how to set and achieve fitness goals. We've all had questions about our health, and sometimes we need help answering those questions. Technology can help us get what we need. You are probably already using technology to find information online or to communicate with your friends and family. Maybe you use it to do your banking or to plan a trip. The same tools can help you better manage your health. This is called e-health. There are different ways technology can support you and your family's health. For example, you can get health information and education from traditional sources like TV or radio. Or you can use the internet to look up information about a health topic or to learn more about a disease. You can also look up your lab results online, track your fitness activities with an app, connect with healthcare providers online, join patient support groups using social media, or access your health records. All of this is e-health. E-health is helping patients and healthcare providers work together to ensure faster, safer, better care. And many of these e-health tools are available in BC for you and your family. For resources and ideas on how to use e-health safely and in partnership with your healthcare provider, visit our website.
Digital medicine, now we have to pass this to Dr. Kendall Hall to tell us what tools are available these days to help you manage diabetes or other chronic diseases. Kendall, I'll pass the mic to you.
Yes, thank you, Barbara. Oh, thank you, everyone, those specialists before me. So it's been really attractive, and I'm really glad to hear that and know that most people find all the information helpful. And for this section, we are going to talk about digital tools for diabetes self-management. So there are 3 different objectives. The first one is to know that there are many ways to see doctors or manage your own health using computers, cell phones, or apps. And the second, give common examples of how this can be done for diabetes management. And the third, how to use virtual care and what to pay attention to. So the very first thing is, well, when you talk about digital, oh no, I'm not very interested in it. It is very difficult. But I can tell you, actually, so gaining access to digital health or virtual health is actually pretty easy. And then even when you start to do it, it is easy. And then there are a lot of things that you can further explore. So today I would like to introduce you to the entrance of this technology. Now, actually, we are using the technology we are using every day. So many of you are watching our forum with a computer, and even for the viewing hub, people have knowledge about computers. And also we have smartphones as well as tablets. So these are actually having a lot of more and more information, allowing us to self-manage our health. So now I'm not too sure. Oh, okay. Now I can move my slides. Okay. Yeah. So now I may ask my colleagues to control the slides then. So let us look at the digital health. So many a times we are using our cell phones, our smartphones. So on the right-hand side, there are smart watches, which can keep track of our heartbeats. And on the left, not only taking record of our blood sugar, but also our blood pressure, as well as our heart rate. And in the center, there will be a lot of apps. There will be apps telling us how to do exercises, not only telling you what to do, but there is a person who is demonstrating. And these are very, very helpful to us. So as we have said, exercise is a big component of prevention or managing diabetes. And tomorrow we'll get more information regarding exercises. So the next slide. Now, earlier on, Laura, the registered nurse, has mentioned this. I'm not going to talk about too much of this. And how can you control your blood sugar almost continually? So this is what we have on the left. This is one kind of the products, and which is called the Abbott Freestyle Lip. And it is a little sensor which is placed on the shoulder and which is connected to your smartphone. And you can see the trend of your blood sugar. And then after eating an orange, you can see your blood sugar is rising a little bit. So this does not only allow us to control our blood sugar, but also have immediate feedback on our body's response to the food we have just said. For example, having the instant oatmeal, you can see how our body responds. And then on the right-hand side, the top right-hand corner is the insulin pump. So it can detect what is happening inside our body. Just at the very beginning, Dr. Charmaine Ma talked about the little man who was moving the sugar into the cells. And these, according to your blood sugar level, to help you to have insulin input. So when you look at these devices, so before we have to poke our finger, see what our blood sugar level, and then we inject our own insulin. But now there are devices which can help us, and they would automatically do that. And on the right lower corner, this is the whole system. It is not only detecting our blood sugar level and how much insulin we need. And there will be also artificial intelligence, which can help us to calculate how much insulin that we need. So to help us further control our diabetes. We're just having a very brief introduction. So actually, Laura has talked about it. Of course, if you're interested, then you can talk to your doctor. And also, you should be more engaged in education programs and to talk with the diabetes nurses to have further understanding. And today, I'm just telling you devices that can help us and how using these are being helpful. So the next slide. Now, the next one is a more general use, which is a virtual care. So just like in the diagram, before we had to see the doctor face to face, and many people need that. But now there are ways we can meet our doctor through the computer, smartphone, or the telephone, or even a tablet. Now, for this one, it is not really for the doctor can reach out from your smartphone to test your heart, to test your pulse. However, there are many things we can do. How can we use such information and communication technology to provide virtual care? So what does it mean by virtual and long distance? If I am in Vancouver, and my patient is in Vancouver Island or BC northern BC. However, sometimes the patient may find it inconvenient or impossible to go out of his home. For example, if the person is having back pain and going to the doctor's office and going even to the emergency room is a long distance. And in this case, it is possible for us to contact you. And in that case, this will be virtual care. Another case is not directly talking with the patient. And then actually, it is between healthcare providers, we are helping each other. For example, we're in the north, there are a lot of good nurses and good doctors, and they are helping their patients. However, sometimes there may be 4 or 5 patients who are coming in, and then we in a VGH, we have more doctors and nurses and friends who can offer help. And if there are smaller towns, sometimes we can use virtual care, helping them here and now to help our colleagues. And the hybrid care will be combining in-person and virtual care visits. Now, so imagine if you go to the bank. So sometimes you may say, oh, okay, I would use the ATM to get cash, or I can pay my bills through the computer. And sometimes I can take a picture so that I can have my check deposited into my bank account. However, for some more complicated things, for example, if I want to get a loan, then I have to go into the bank to see my account manager. So it is the same with healthcare. So it is easier to see the doctor, but in many situations, so well, we have to go in person. So the next one. So actually virtual care, we can make use of different communication technologies. For example, video conferencing like now, telephone, text messaging, or even email. For example, I have some rash I would like to see, and then just talking, well, I would like to see the situation, so you can place your hand as close to the camera as possible. And you can also take a picture, and then the doctor can see much clearly. And this can all help us through virtual care. Now, of course, there are benefits. Saving time. For example, if it can be done through virtual care, then we do not have to go to the doctor's clinic. We don't have to drive. We don't have to park. And then that will be a great help. And if you're in the interior and you have to fly to Vancouver, spend a night in the hospital and see the doctor the next day for just 10 minutes, and then you have to go back to the hotel and take the flight back home, of course, it will be a much longer duration of time. So if it is suitable, virtual care can help. However, and then if the health situation is not serious, then can decrease the use of emergency room. And then if you use 811, this service is actually to differentiate whether your symptoms require you to pay a visit to the ER. And also you can reduce the spreading of diseases. So today, we are doing it online. So we are not spreading viruses or diseases to other people. And this is our wish, that everybody remains healthy. And some people say, oh, if I go to the clinic or if I go to the ER waiting area, that will increase the risk of passing and catching diseases. But I would like to stress, if you do require emergency care services, things like heart problem, stroke symptoms, then don't worry about the risk of catching diseases. Our hospitals are very well equipped, so are the clinics of our doctors, so that we will protect you from contracting viruses or germs. So if it is necessary, go for it. So the next slide. So what are the limitations of virtual care? Now, if you do not have a regular healthcare provider, and then you just go to have care through virtual care, then your GP may not really understand your situation, and there will not be a continuity of your care. And so you may say, well, this is easy. I would just go to A, and then I could go to B clinic. But your history may not be pulled together and being governed by a partner who is your family doctor and helping you to monitor your health. The second thing is virtual care cannot help you to deal with emergencies. When a person is facing emergency, then don't delay. Do not use virtual care. Go to the hospital or the clinic. And the third one is for clinical appropriateness. So for me, through virtual care, really, well, cannot help. For example, if you abdominal pain, well, I can talk about it, but I cannot really examine you. I cannot reach out through the screen and push you. So for the family members beside you, I might be able to help, but I cannot listen to your heart. I cannot listen to your lung. And for the time being, virtual care cannot do all this. And in these situations, so let us look at the next one. Oh, okay. Yeah, the previous one. So talking about emergency care, if you suddenly have a chest pain, and the chest pain lasts for 15 or even 20 minutes, don't wait. So for this situation, or let me see whether I can get virtual care through my doctor or whether I can go online. So in situations like these, even calling 811 is too slow. Call 911, especially when you have symptoms of heart diseases, especially when it is the first onset. Go to the emergency room. Don't use virtual care. And finally, I have got some tips. And before you use the virtual care, what preparations can you have? And so that virtual care can be more helpful to you. The first thing is, before receiving virtual care, you have to call the doctor's office. Now, if you have a family doctor and you are not sure whether your family doctor provides virtual care, then call to find out whether they have virtual care. If they say yes, okay, then you can properly prepare yourself. And to prepare yourself, you have to think, what device? Am I only using the phone, or do I use my smartphone, tablet, or my computer? And the third thing is very important. If you are doing virtual care, you have to choose a private and a place which is well lit. look at this. If I turn off my light, then it is bad. I cannot see you. But if you're in a place which is well lit, then I can have a much better observation. And another thing is if you have family with you, so we welcome, many doctors welcome them. Oh, I have my daughter or my son next to me. Of course, I would welcome that. So in that case, you have to let me know. And then my son is with me. So this is something which is really beautiful. And make sure you go to a place which is quiet. Now, sometimes they give me a call through 811, but oh, they are in the middle of a coffee shop. So in that case, oh, then I said, sorry, I cannot talk to you. So if you're using virtual care and then you're connected with the doctor and you're in a place which is not private enough, then you have to let the doctor know. And we would like to ask you, well, are you in a place which is quiet and private enough? So do you think it is safe and appropriate to talk to me? So this is something to communicate. And also, if possible, before the actual virtual visit, then do a test call. Now, when you see the doctor, so when it is the first one, of course, you need your insurance card and then what records you have. So, well, I have paper and notes, and then my children will say, oh, you are not advanced. I usually would key in everything in my smartphone, so you can get that ready too. And if you have history, say the blood medication, what symptoms you have, especially so if it is the first time you see that nurse or doctor with that information, it would be very helpful. The last one, there are a few things I think people should be aware of. So if you go to the hospital, there will be the nurse who will to measure your blood pressure or your temperature. But at home, we cannot do this for you. So I suggest, so you have to prepare yourself a few things. The first thing is how to test your body temperature. Of course, you can do it over your forehead or under your tongue, or that is a infrared thermometer. If you can tell me your temperature, that will be a great help. The next one is about blood pressure. So I suggest everyone has a blood pressure monitor at home because blood pressure would be important for healthcare professionals to help you. Now, this is actually hypertension.ca. This is a nonprofit website, but this is very important. Of course, it is about hypertension, providing a lot of good information, but one of it is if you are planning to buy a blood pressure monitor, then it would tell you which one is helpful. So there will be the golden check. So this is what they recommend. And you can see how to buy these kinds of recommended monitors. And the third one, we would like to know your heart rate. Now, many people they are wearing different watches and how fast your heart is beating. And there are free apps which can be downloaded. Now, remember, they are free. So they can be downloaded into your smartphone and then place your finger at the area where it is lit, and then it will count the heartbeat for you. I cannot tell you how to look for it, but I hope there will be workshops which can further help you. And the last one is about the oxygen saturation. Now, usually this one, usually you can buy these ones from the drugstores. In that case, we can tell how saturated the oxygen is in your blood. If I know your heart rate, if I know your blood pressure, if I know your temperature, they are very good. However, if you can tell me the oxygen saturation, it will even further help me. So If you could do so, please do so. Now, some watches claim they can test the blood oxygen, but usually up to now, so only through the fingertip and through the earlobe would be more accurate. So wearing a watch on the wrist, the accuracy is not as proficient yet, and I'm not reprimanding that. So the last one, to me, this is really important. This is Health Gateway, which is provided by the government, which is non-profit making. And I think you actually should have known this, because in the past 2 years, so if you would like to register yourself for inoculation for COVID shots, and if you had to go into the restaurant to show that you already had a barcode, then actually you have gone through the Health Gateway. So if you have done that, you have already signed in into Health Gateway. And if you have not, then there is the link. Go to the website, and then you can start working on it. Why is it important? Because this app has already downloaded many of our own health information. So it's not only our COVID shots, but all our inoculations, for example, even under the medical board, and all these shots that have been done are recorded. And also you can find record of your medication. And the third one, it keeps record of all the clinics of doctors you've been to. There are reports there. And the fourth one, it will be all the lab work. Now, before, when I wanted to check my lab result, then you can go to the through the lab, and then you can sign in so that you know. But now you can know all the blood work result within 48 hours on the Health Gateway. So you don't just look at the lab result, but you can have the history of what other examinations you have gone through before. And also for Health Gateway, you have to key in something, for example, annual blood value. And then the doctor may will say, well, okay, I can note it. This time my blood sugar is a little bit high. So you are building up your personal data, and all this information is protected. Your privacy is guaranteed. And down the road, we can find more and more information in the Health Gateway, and we will talk about more of this in our workshops. The next one, we are talking about almost the end of my presentation. So in the very beginning, there was a video about the HealthLink BC. So if you have any questions, there is a lot of information online. And also you can dial the phone number 811, and then you can say your language of choice, English, Cantonese or Mandarin or whatever, and then they will have interpreters who can reach you for different information. There will be different doctors working with the nurses, providing virtual care. I hope that all this information, which can guide you to further information, and I really hope that there will be workshops who can further look at digital health. And then here are some further links providing community resources, and I hope these will help. So passing on the time to you, Barbara. So thank you, Barbara. So now with the advancement of knowledge, there are so many different equipments or apps. I agree that everyone, people in BC should try to use Health Gateway to look into your own health record for the time being part of your health record. And for many people, they say, oh, I do not have a family doctor, or my family doctor has retired. But if you have all this information, then you can do better self-management.
So if you are taking part for the first time, you have not been registered in our email list, you can scan this QR code to join our iCON mailing list. And in future, whatever activities we have, we will let you know in the first instance. I want to thank our community partners who are, well, there are very many, you can see. They are Vancouver Coastal Health, Fraser Coastal Health, CMHA, and South Vancouver Neighborhood House, Richmond Cares, Family Caregivers BC, UVic, Self-Management BC Institute on Aging and Lifelong Health, Vancouver Divisions of Family Practice, and Vancouver Public Library, as well as Villa Cathay Care Home and Richmond Gives Caregiver Hub, Mosaic Caregiver BC. Thank you to all of you to help us promote and advertise this program to the public out there. And I also want to thank our media partners. They include Fairchild TV, Omni TV, Ming Pao Daily News, and as well as Singtao Daily Group. And I also want to thank over the last 2 days, the hubs that were open have been open to the public. They include CLC Health Center, Jackson Lamb Adult Daycare Center, Day Center, South Vancouver's Neighborhood House, and Villa Cathay Media Partners. Those are our media partners. You want to watch those presentations again, as well as other presentations, you can go to our www.iconproject.org website, as well as icon.support@ubc.ca to review those presentations.